So, difference between modified radical hysterectomy and radical hysterectomy. So, you have to remember mostly we remove everything half in modified radical hysterectomy. Like we remove definitely the uterus and cervix, and we remove the proximal vagina and half of the uterine vessels till the urethra crossing, half of the ligament, uterosacral ligament or cardinal ligament, whereas completely removed in radical hysterectomy up to the origin itself, up to the farthest point. For example, uterine vessels up to the origin from the internal iliac. Then brachytherapy, you have to remember the dose and the distance you are keeping. Where you are keeping, it is kept in the uterine cavity, and the value is 2, 5. So 2 plus 2, 5. Then how much? That is the distance. 2 lateral, 5. 2 is to the lateral and up. 5 is to the lateral to that point A. And how much dose? How can you remember? 6,000 to 7,000 and 8,000. So you have to remember a line taking U-turn. Initially 2 plus 2 around, it is 4, but actually remember 5. So 2, 5. Corresponding to 5 you have 6,000 to 7,000, corresponding to 2, 8,000 gyre. Respiratory change in pregnancy, since the uterus is getting enlarged, lungs compressed, so total lung capacity will be low. Respiratory rate and tidal volume will be, what happens to the respiratory rate and tidal volume? Will increase. It is a shallow breathing, so they will breathe fast. LAD, anti-GADA antibody, is in latent autoimmune diabetes. UIP versus NSIP. UIP, it will be having traction, bronchiectasis and honeycombing. NSIP, ground glass. Changes in hyperkalemia, initially T wave, hyperacute, tall tended T wave, then P wave, loss of P wave, then QRS, broad, then sine wave. So remember, T after it's not QRS, it is P, then QRS. Last sine wave. TLD regime, tenofovir, lamivudine, dolutegravir. So T and L is 300 mg, D is 50 mg. HbA to normal value 2 to 3 is in trait, thalassemia trait, 2 trait. Okay. Menopause, 12 months there should be absence of menstruation. In menopause, what happens to LH and FSH will be high, the hormones are low, so feedback, LH FSH will be high. Before menarche, what happens? LH FSH will be more than LH because follicles are developing. But during once menarche attained, then LH surge that will be gradually increased over every menstruation. Phyllodes tumor, stromal element and epithelial element. So when it becomes malignant, epithelial will be decreasing, stromal component increase. Autoimmunity in Epstein-Barr virus infection. Polyclonal. Why autoimmunity occur in Epstein-Barr virus infection? Polyclonal B cell activation. Tropharema whipplei, the pass positive and diastase resistant. Inflammatory bowel syndrome, the main symptom is abdominal pain. Then next is the types of culture. So antibiotic sensitivity testing done in lawn culture, and in power plate culture we are looking the viability of bacteria. Then streak culture, that is we are culturing the organism, and stab culture looking for oxygen usage. Complement fixation test example is Wassermann and TPI. Neutralization test, Nagel's and Schick test. GAG gene is for outer core and shell protein. Outer shell and core protein. GAG pol ENV. Pol is polymerase enzyme. ENV is envelope. Stages absent in leishmania. So usually in hemophlagellite the stages are plata, promastigote, then epimastigote, trypomastigote and amastigote. In leishmania E and T is absent. Epi and trypo is absent. Epidemic versus endemic relapsing fever. Epidemic is recurrentis Borrelia recurrentis. Endemic is Borrelia dattoni. Factor 10 is produced by Staph aureus. Marinum is photochromogen. Annulus tympanicus is in pars tensa and pars flaccida has sharpener membrane. Cricoid cartilage undergo calcification. Theories of cholesteatoma. Haberman's theories. In hub we are invading, so that is theory of invagination. Whitman's retraction pocket. Said's theories. Rude is basal cell hyperplasia. Said is metaplasia. Then next JNA treatment of choice radiotherapy. No, treatment of choice surgical excision. When it is recurrent or inaccessible, radiotherapy. Widening of meatus seen in keratosis obturans. Calcification normally occur in brain, that is pituitary, habenular commissure, then basal ganglia, choroid plexus, white cerebellum white, then drowning, head injury, and meningitis, encephalitis. Opacification of lungs occurs in either tumor, collapse, pneumonectomy. TLD is for monitoring of the exposure of radiation. We use lead apron, but this TLD do not contain lead. That's a tricky question. So stay tuned. Till then, bye.